Hi, I'm Kelly, Oncology Account Manager for Potoligio, mogamulizumab. Potoligio is indicated for the treatment of adult patients with relapsed or refractory mycosis fungoides or Sézary syndrome after at least one prior systemic therapy. In the clinical trial, the most common adverse reactions reported in 20% or more patients were rash, drug eruption, infusion reaction, fatigue, diarrhea, upper respiratory tract infection, and musculoskeletal pain. Welcome to Potoligio Points. Today I'd like to discuss results from the Maverick trial, specific to patients with blood involvement and in SS patients. Potoligio was approved by the FDA based on results from Maverick, the largest randomized study of a systemic therapy for MF and SS. The primary endpoint was progression-free survival, or PFS, which was rigorously assessed across 4 disease compartments: skin, blood, lymph nodes, and viscera. Notably, nearly half of the patients had SS. Potoligio demonstrated superior progression-free survival versus vorinostat, more than doubling the time to progression with a median of 7.6 months versus 3.1 months with vorinostat. In the cohort of only patients with SS, which was 45% of the study population and was a predefined subgroup, Potoligio demonstrated 4 times longer PFS in SS compared with vorinostat, with a median of 13.3 months and 3.1 months with vorinostat. Potoligio is the only FDA-approved agent that has demonstrated PFS benefit in patients with SS. As with the entire intent-to-treat population in Maverick, Potoligio in the SS-only patients also demonstrated a higher response rate and a more durable response compared with vorinostat. In patients with SS, there was an 18 times greater response, which lasted 2.5 times longer. That said, and although these were predefined subgroup analyses of the secondary endpoint, the study was not powered to discern significant differences between subgroups. Because there is, by definition, a high degree of blood involvement in SS, it's worthwhile to look at the Maverick results in blood. In this disease compartment, Potoligio demonstrated a 3 times greater response rate and a longer duration of response compared with vorinostat. Response in blood in the Potoligio group lasted more than 2 years. Note that response by disease compartment was an ad hoc analysis. Duration of response by disease compartment was a post hoc analysis. Findings from post hoc analyses cannot be used to demonstrate differences between treatments and may not be applicable to all patients initiating Potoligio. Finally, let me remind you of the adverse reactions that occurred in 10% or more of Potoligio patients, including those that occurred at a 2% or higher rate than vorinostat. The most common adverse reactions were infusion reaction and drug eruption. Feel free to pause the video and review the table in greater detail. Additional information about adverse reactions can be found in the package insert available at potoligiohcp.com. I hope this information was helpful. If you have any questions about Potoligio, please contact your oncology account manager. Stay on the lookout for more video details from me and my colleagues at Kyowa Kirin. Please take a brief moment to read and listen to the full important safety information for Potoligio, and thank you for your time.
Indication: Potoligio mogamulizumab-kpkc injection for intravenous infusion is indicated for the treatment of adult patients with relapsed or refractory mycosis fungoides, MF, or Sézary syndrome, SS, after at least one prior systemic therapy. Important safety information, warnings and precautions. Dermatologic toxicity. Monitor patients for rash throughout the course of treatment. For patients who experienced dermatologic toxicity in Trial 1, the median time to onset was 15 weeks, with 25% of cases occurring after 31 weeks. Interrupt Potoligio for moderate or severe rash, grades 2 or 3. Permanently discontinue Potoligio for life-threatening grade 4 rash or for any Stevens-Johnson syndrome SJS or toxic epidermal necrolysis. 10. Infusion reactions. Most infusion reactions occur during or shortly after the first infusion. Infusion reactions can also occur with subsequent infusions. Monitor patients closely for signs and symptoms of infusion reactions and interrupt the infusion for any grade reaction and treat promptly. Permanently discontinue Potoligio for any life-threatening grade 4 infusion reaction. Infections. Monitor patients for signs and symptoms of infection and treat promptly. Autoimmune complications. Interrupt or permanently discontinue Potoligio as appropriate for suspected immune-mediated adverse reactions. Consider the benefit-risk of Potoligio in patients with a history of autoimmune disease. Complications of allogeneic HSCT after Potoligio. Increased risk of transplant complications have been reported in patients who received allogeneic HSCT after Potoligio. Follow patients closely for early evidence of transplant-related complications. Adverse reactions. The most common adverse reactions reported in greater than or equal to 10% of patients with Potoligio in the clinical trial were rash, including drug eruption, 35%, infusion reaction, 33%, fatigue, 31%, diarrhea, 28%, drug eruption, 24%, upper respiratory tract infection, 22%, musculoskeletal pain, 22%, skin infection, 19%, pyrexia, 17%, edema, 16%, nausea, 16%, headache, 14%, thrombocytopenia, 14%, constipation, 13%, anemia, 12%, mucositis, 12%, cough, 11%, and hypertension, 10%. You are encouraged to report suspected adverse reactions to Kyowa Kirin Incorporated at 1-844-768-3544 or FDA at 1-800-FDA-1088 or fda.gov/medwatch. To learn more about Potoligio, visit potoligiohcp.com.